Obstructive sleep apnea has to be a part of a preventive cardiology program. It is so complex and so problematic and puts the heart under such terrible stress if you have untreated sleep apnea. Here's our roadmap again. We're nearing the end of talking about preventive cardiology, but here we go. Let's talk about sleep apnea. I talked about Dr. Dorninger, and I remember a lecture series when he was talking about if someone has AFib, you absolutely have to rule out obstructive sleep apnea. I agree with him, but I think you have to rule it out in every single patient that's trying to prevent cardiovascular disease, which means you either got to refer them for sleep testing or you got to do an overnight oximetry. There's a million devices. I'm not going to talk about all the different devices. There's so many out there that you can use. Don't get sucked into the typical phenotype. This is the stereotype. This is what it looks like. Overweight, very large chin, right? This is predictive. This guy's got sleep apnea. There's no question about that. But about 25% of people who are very thin also have sleep apnea because it has to do with the size of the oral airway. I like to use a Mallampati score. Now, a Mallampati score is not predictive of sleep apnea. It is an eyesight test that an ER physician would use to predict how easy would it be to put an ET tube, an endotracheal tube, down into the larynx and the trachea so that we can mechanically breathe for a given patient. But primary care doctors have hijacked the Mallampati score. This is what we use on physical exam to say, oh, dude, you got to go get sleep apnea testing. I can tell you that when I talk about sleep apnea, as a general rule, my patients say, nah, I don't want to do that. I don't want to go sleep at some other lab. It feels creepy to me that someone's watching me sleep. My dad did that and he was tied with wires and he says it was a terrible night's sleep. I don't want to do it. And I always say, okay, open your mouth. Let me look at your airway. Oh, yeah, you're a Mallampati class 4. And they're like, what? Potty what? Potty mouth 4? And I say, no, look, right here. I show them this picture. I have this in my office. And I say, I want you to go into the bathroom, open your mouth and say, ah. When you do that, you're looking to see, can you see the oral airway? If they look like this over here, class 1, they're less likely to have sleep apnea. It's not definitive. This is not a definitive test, but this is a marker to say, do you need to be screened? If they're over here and look like a class 4, I'm like, go look at that. Can you see your airway? No, neither can I. You have sleep apnea until proven otherwise. Oh, so you think I really need to go? Yes, you need to go get that done because you're going to feel better and lower your risk of cardiovascular disease if we correct your sleep apnea. Okay, I'll go do it. This simple test helps me to prevail in helping patients to understand the importance of that testing. On top of that, I would ask them, do you have asthma? Do you have COPD? Were you ever a smoker? Do you have pulmonary fibrosis? Recurrent pneumonia? Do you have any type of respiratory illness? Have you ever seen a pulmonologist? We already talked sleep apnea and Mallampati scores, right? All of these help me to predict how difficult is it to get oxygen into the body. Remember, the entire purpose of the heart is to pump blood to the lungs so they can pick up oxygen, and then take that oxygen to the various tissues of the body so they can operate the Krebs cycle and produce energy. So if you can't get oxygen very easily, you're screwed. You've got to address obstructive sleep apnea. So again, we look at that Mallampati scoring to help us predict whether or not someone needs testing. But when they open their mouth, I want to look at their tongue. And I start paying attention. Do they have a crowded airway? Do they have this big, fat, thick tongue for their small mouth? Do they have scalloped tongue? Look at this right here. A scalloped tongue means that the actual oral cavity is quite narrow and the tongue is constantly pushing against the side of the teeth. And the teeth get imprinted on that tongue. That, my friends, is a very crowded airway. That, my friends, is obstructive sleep apnea until proven otherwise. And when I see that and point that out to my clients, it's definitely a part of my cardiology prevention program. When I look at them, I'm paying attention to the actual facial structure. Look at this right here. This is a recessed chin. And there's some big words in there. I won't try to use them because I'll butcher them. But if that chin is recessed and set back, it means that jaw is pushed back into the oral airway. And again, that's going to be another predictor of some sort of disordered sleep. So you can see right here, normal occlusion and bite, the teeth match up. But on a distal occlusion, that underbite right there, that overbite, that bottom jaw is recessed posterior back towards the airway, and it's going to close that airway down a little bit. So just by looking at your patients, they walk in your office, I'm examining their facial features and I'm making predictive summaries. Oh, we got to get obstructive sleep apnea testing. Open your mouth. Let me see the airway. Let me see your tongue. I want to see if there's a scalloped tongue. These things help me predict whether or not this is something that has to happen. And oftentimes, if I look at them, they're a class 1, they're relatively thin, they've got a good jaw that's not recessed with a total overbite. Those would be people where maybe I don't start with that, but depending on what their coronary artery calcium score is, I might circle back to that if they have profound disease. Anytime an individual has cognitive decline, they have to be tested for sleep apnea. That is a red line for me. And I will never cross that red line. If someone comes in and they say, my memory's struggling, it's not very good, I'm tired all the time, man, they just get sleep apnea testing. So I'm killing two birds with one stone. Preventive neurology, preventive cardiology. And oftentimes, if they're hesitant, I start with an overnight oximetry. And that helps tell me so much about their sleeping patterns at night that I can predict whether or not they need to do the full-blown overnight oximetry, overnight sleep study.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.